Assalamu alaikum viewers, we are studying the clinical consideration of dentin. The cells of the exposed dentin should not be insulted by the bacterial toxins, strong drugs, undue operative trauma, unnecessary thermal changes, or irritating restorative materials. One should bear in mind that when 1 square of the dentin is exposed, about 30,000 living cells are damaged. It is advisable to seal the exposed dentin surface with non-irritating insulating substance. The rapid penetration and spread of caries in the dentin is the result of the tubule system in the dentin. The enamel may be undermined at the dentino-enamel junction even when the caries in the enamel is confined to a small surface area. This is due to in part to the spaces created at the dentino-enamel junction by the enamel tufts, spindle, and open and the branched dentinal tubules. The dentinal tubules provide a passage for invading bacteria and their products through either a thin or thick dentinal layer. Electron micrographs of the carious dentin shows region of the massive bacterial invasion of the dentinal tubules. The tubules are enlarged by the destructive action of the microorganism. Dentin sensitivity of the pain unfortunately may not be a symptom of the caries until the pulp is infected and spawned by the process of inflammation leading to the toothache. Thus, patients are surprised at the extent of damage to their teeth with little or no warning from pain. Undue trauma from the operative instruments also may damage the pulp. Air-driving cutting instruments cause dislodgement of the odontoblast on the periphery of the pulp and their aspiration within the dentinal tubules. This could be an important factor in survival of the pulp if the pulp is already inflamed. Repair requires the mobilization of the macrophage system as healing takes place. As this progresses, there is the contribution of the deeper pulpal cells, although cytodifferentiation into the odontoblast which will be active in the formation of the reparative dentin. The sensitivity of the dentin has been explained by the hydrodynamic theory that alteration of the fluid and the cellular contents of the dentinal tubules cause stimulation of the nerve endings in contact with these cells. This theory explains pain throughout the dentin since fluid movement will occur at the dentino-enamel junction as well as near the pulp. Because we know that the reparative dentin is stimulated by the cavity lining materials and that dentin form throughout the life of a tooth, it is now possible to save teeth that previously was lost by extraction or treated by the endodontic therapy. Again, teeth with a deep penetrating carious layer can be created by only partial removing of the carious dentin and insertion of a dressing containing calcium hydroxide for a period of few weeks or months. During this period, odontoblasts form new dentin along the pulpal surface underlying the carious layer, and the dentist can then reopen the cavity and remove the remaining bacteria-laden decay without endangering the pulp. This treatment is termed as indirect pulp capping. Today there is research on the permeability of dentin. Fluid flow caused by the hydrostatic pressure is directly proportional to the number of tubules and radii of tubules per unit surface area of dentin. Thus, coronal dentin is most permeable over the pulp horns. The permeability of the radicular dentin near the pulp is only about 20% that of coronal dentin. And the permeability of the outer radicular dentin is about 2% of the coronal dentin. That suggests that the outer dentin of the root acts as a barrier to the fluid movement across dentin in the normal circumstances and recalls the correlation between the root planing and hypersensitivity. A number of factors have been noted to interfere with the fluid flow in the tubules, such as when protein and apatite crystals are present in the tubules. Perhaps the most surprising is the effect of the smear layer on the cavity floor created during cavity preparation. Although it reduces permeability temporarily, it is a bacteria-laden mess, and it is important to remove it because toxic products will migrate to the pulp. A cavity liner is then recommended to line the cavity. Thank you so much for watching the video and don't forget to subscribe the channel.